Good morning, folks. Welcome back to the channel, denwalker.com. Welcome back. Happy Friday. I've been meaning to put this video out for a little while, and just one thing versus the next. But this morning I thought I'd put it out there and just to let people know what is available to them regarding certain conditions. So one of the things that I love to take, and I take it because it for two reasons. One, this thing helps to prevent small clots from forming. Also, this item is fibrinolytic, which means that it helps to break down small fibrin formation or clot formation in many people, and also there's an association between this thing and what's called a von Hillebrand factor modification. So in other words, it prevents sort of platelets from sticking, from clumping, which also then prevents you to create essentially blood clots. And so I spoke with a lady probably 2 weeks ago now, and one of the things that she had was elevated heart rate. And sometimes when you have either hypercoagulable states from any condition, hypercoagulable means that you have tiny clots in your system, things can happen. For example, blood pressure elevation could occur. You could have a rapid heart rate. And a lot of this stuff has happened in the last, I don't know, 3-4 years. I don't know what's changed in terms of shots over the last 3 or 4 years, but anything you've taken that causes clots, that is causes hypercoagulable state, essentially increasing clot risk or clot formation, you run the risk of stroke, heart attack, obviously blood pressure disorder, elevated blood pressures, and so forth, and the lot. So, but I've been taking it not because of necessarily blood pressure and those things, but it's just one of those things that kind of keep your blood essentially free flowing and making it less sticky, if you would. And it's called Nattokinase, and it's a Japanese food product that they've used for centuries. And, you know, folks will tell you, oh, well, it's not been proven and it's not been scientifically proven to do all this stuff. But again, the Japanese folks have been using it for thousands of years, and they're still surviving and doing well. Anyway, the study that I read looked at all these folks that had blood pressure disorders, and they gave them 100 milligrams essentially of natto. And nattokinase is the enzyme actually from natto, and it's really, again, it's a fermented soy product that folks, it looks like sticky beans when you really look at it. And they add it to sort of any food. You can also get it in a capsule formation as well. But anyway, they've been using it for a very, very long time. Lots of wonderful benefits, include, again, blood pressure disorders, tachycardic disorders. But before you jump on the whole blood pressure medications and so forth, talk with your doctor, obviously, and let them know what it is you're going to try. And again, nattokinase is what I'm talking about. But now I'm talking about several things that can help you with your blood pressure, as opposed to going to all of those other materials. And the reason I like supplements from this standpoint is because there's little side effects to most of these things, and everything else, most other things you take, I should say, that's in a pill formation, in a bottle formation that your doctor give you, they tend to have some additional side effects. So I like supplements because of that. So nattokinase is one thing that can help your blood pressure elevation. The other thing we talked about before is magnesium glycinate specifically. If you have migraines, remember magnesium oxide tend to help with those. So magnesium glycinate is what I suggest for people at night, at night. And again, that relaxes your blood vessels, dropping the blood pressure. And that's both numbers. That's the top number systolic, and the bottom number, the diastolic, drops both of those. And then potassium is the other one. And then the other one that helps is just increase your garlic consumption. So try those and let me know which works best for you. And just kind of remember also, when I talk about things like magnesium, I said 400 milligrams for the magnesium. That is the lowest recommended dose for men, specifically by the RDA. And lowest meaning that is the dose of magnesium that they tell you will help to prevent disease. It's not to maximize things, it's to help prevent disease. So I'll give you another example. they'll tell you that vitamin D3, that the recommended dose is 800 units of vitamin D3. And that is the minimum recommended dose, right? And as we all know, the minimum recommended dose for a lot of things, like vitamin C, for example, very low dose to prevent scurvy. Vitamin D, 800 units, I can't say it does nothing for you, but just remember that, right? You can, talk with your doc and kind of get an idea, if 400 milligrams is not working for you in terms of blood pressure, talk with them and maybe, looking at 500 or 600 and make certain that they're, in league with what you're talking about. But, you can try some of the additional things. So anyway, nattokinase, you can try. Magnesium glycinate, you can try. Add more potassium or potassium foods, you can try. And the last one, again, is just adding more garlic. And again, garlic should be not fried, not cooked, sauteed, or raw. Thanks for listening, Dr. Walker. Have a great day.